Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer of Atlantic Coast Aesthetics. And Dr. Pane, this question comes in off of Facebook, and we have a fellow here who's lost a lot of weight. Is curious, is a tummy tuck or cool sculpting, or what are the options after someone loses a lot of weight? They've lost a lot of weight. It looks like they're down to about 185 pounds, and they were about 250, 275. So congratulations on the weight loss. And Dr. Pane, what would you suggest in this situation?
Well, here, we were shown some photos, which was a slender man with some loose skin hanging around the waistline area. Not a tremendous amount of skin hanging, considering the amount of weight that was lost, which was over 100 pounds here. But it's important to realize that when you gain and lose weight, the skin gets stretched out, and the elastic fibers, the tight springiness to the tissue that we have when we're, say, years old, 20 years old, that is lost. Now, that'll be lost with time, of course, when we age, but it will be lost faster if there's weight gain and loss, which is mostly commonly encountered in plastic surgery, two areas: women that have childbirth, and then people that have bariatric surgery. And that's where most of the men come in. They either lose weight through some sort of surgery or diet and exercise, like happened in this case. Now here, the skin has been stretched out. So for that reason, exercise is not going to tighten the skin. All of the things that you'll hear about that are non-invasive, that tighten skin slightly, but they're not really intended for this population where you have had a tremendous amount of weight loss. So I would say things like the cool sculpting, liposuction, or any of the non-invasive skin tightening things are to be probably avoided in almost all cases here. The only one that might possibly have any utility would be liposuction in spot areas where the skin isn't real loose, maybe on the back or some other area. And even that, on a per case basis, you'd have to check. So by and large, the only way to get rid of that excess skin is to excise it. Now, in this case, there wasn't a lot of looseness above the belly button. So the person could get a standard tummy tuck, maybe an extended tummy tuck, or even a lower body lift if you want to get into more extensive scarring, depending on what their goals are. The tummy tuck that has the up and down scar, the inverted T, might be an option for the person, either if they already have a scar for some other reason, which they don't in this case, or they really want that belly as tight as possible, and they're not concerned with a vertical scar that they would not be able to hide. Most people with this kind of anatomy would choose one of the extended tummy tuck options where the scar can be hidden. So I don't tell people, hey, you have to do it this way, you can't do it that way. Some people will tell them that, and you have to be careful during the consultation that you're getting a reasonable assessment of what the options are. So I would say in this case, extended tummy tuck, best option. Avoiding the other non-invasive type treatments because we're dealing with loose skin that's been stretched out. We're not going to get a lot of benefit out of those techniques. But the excisional surgery, again, you're trading loose skin for scars, but in people that have lost a lot of weight, the trade-off is very good. And it's really the way to go when you talk about reducing that excess skin and getting back to a body shape that you want to achieve after having made such good advances by losing all that weight. So a little bit of a long answer, but it should cover that pretty well.
Well, thank you, Dr. Pane. And if you have a question for the doctor, please visit our website or Facebook page. And Dr. Pane, we'll see you on the next question.
Great.